Good evening, Suswagatam. You are all welcome to Saspandan TCM Academy. So, I am Vivek Rane, practicing acupuncture from last 35 years and teaching acupuncture from last 25 years. Friends, let us discuss today about the most common problem. It is the dry skin. Dry skin. So acupuncture for the dry skin. Let us now go to the visual diagnosis of the skin. Our topic is dry skin. Friends, the most common cause of dry skin is liver blood deficiency. If you are knowing the TCM, you are familiar with the TCM, so you may know the most common cause of dry skin is the liver blood deficiency. This is especially common in the woman. Liver in and kidney in deficiency are a common cause of the dry skin in the elderly people. And in some cases, dry skin may be due to stomach indeficiency. A particular type of dry skin is due to chronic blood stasis also. So blood cannot flow properly. So in some cases, the dry skin due to chronic blood stasis. It results from the interaction and the mutual exchange of the blood and the body fluid. Friends, stagnant blood may damage the circulation of the body fluid, and this may cause the skin to become dry. Why skin is becoming dry? Because of stagnant blood may damage the circulation of the body fluid. Dry skin from the blood stasis happens only in the chronic case when the blood stasis is severe, and it is very common in the elderly people. So it is easy to differentiate between the dry skin due to blood stasis and that due to in or blood deficiency. So because in the previous case, the skin is also dark and the lack of luster. Okay, lack of luster. Okay. Your skin shining will be go. It is the no shining in the skin, lack of luster, and the nails are often dark and purple and dry and with thread. Now, apart from that, there will be some general symptoms and the sign of the blood stasis. So, in summary, let us summarize. The dry skin may be due to liver blood deficiency. This is the common cause. Liver and kidney indeficiency. Also, liver and kidney indeficiency. Kidney is the mother of the liver. If kidney indeficiency there, obviously liver indeficiency also there. And stomach indeficiency because of if there is the stomach indeficiency, there is the deficiency of the body fluid. Okay, and chronic blood stasis. Okay, these are the main positive factor in the dry skin. Now, empty heat. So let us discuss about the empty heat. So when the liver blood deficiency, if you find the patient who have the liver blood deficiency, so there is the empty heat. So there, what are the symptoms? There will be dry skin, dry hair, dizziness, blur vision, floaters, numbness or tingling of the limbs, scanty menstruation, dull, pale complexion. Okay, complexion will be dull and pale. A pale tongue, will be, if you see the tongue will be pale with the pulse that is the choppy or the fine. Okay, and acupuncture point to be used are the liver 8, ST36, DIN 6, and REN 4. Okay, so there are the total 10 points are there. Pericardium 6, SP6, okay, liver 8, SP10, CV4, then ST36, UB17, UB18, UB20, and UB21. Okay, so there are the 10 points. So you should use this point bilateral. And you have to give the moksha to all points. So when you are going to give the moksha to all points, that blood deficiency will be recover faster. Then second pattern is the lung indeficiency. It's caused the dryness of the skin, lung indeficiency. Okay, so for the dry skin due to lung indeficiency, so there will also be thin hair. Hair will be thin. Okay, dry cough and weak voice. Voice will be weak and dry throat with the desire to sip water. And voice will be hoarse voice and night sweating. Tiredness, patient will be suffering with the tiredness. Tongue without coating in the front and the floating and empty pulse. And what are the acupuncture points? You should note this acupuncture point if there are these symptoms you observe of the lung indeficiency. So acupuncture points to be used are the LU9, it is the source point of the lung, SP6 and REN 12. Okay. Then third pattern, it is the kidney indeficiency. Okay, kidney indeficiency, this is the major factor for the dry skin. So for dry skin due to kidney indeficiency, there will be also be a dry hair. Hair will be dry because kidney governs scalp hair, dry eyes. Okay, and dizziness. Patient को चक्कर आएगा, tinnitus, okay, ringing sound in the ears, hardness of the hearing. Patient cannot be hear properly. Okay, kidney open to ear. Okay, hardness of the hearing, poor memory. Okay, and night sweat, dry mouth, and throat at night, and lower back ache. Okay, lower back ache and soreness. Then constipation, dark scanty urine, and tiredness. A normal color tongue without coating. Tongue will be normal color and it will be without coating, and a pus that is the floating empty. And acupuncture points to be used, write down kidney 3, REN 4, SP6, and REN 12. Again repeating kidney 3, REN 4, SP6, and REN 12. This is for the kidney in deficiency. Now let us discuss the other patterns for the dry skin. So liver indeficiency. Liver indeficiency. Okay, points are for kidney indeficiency. It is that kidney 3, REN 4, SP6, and REN 12. Okay, Indrajit ji? Okay. Now our next patterns is the liver indeficiency. So what are the symptoms for the dry skin? If the skin is dry due to liver indeficiency, the symptoms are there will be dry hair, dry eyes, floaters in the eyes, blur vision, dizziness, chakkar aayega, dizziness, numbness or tingling of the limb, scanty menstruation, dull and pale complexion, but with the red cheekbone. Okay, cheekbone will be red, and on all over the complexion will be dull and pale. Okay, and then withdrawal and the brittle nails. Also, it's indicate the liver indeficiency for the dry skin. Okay, dry skin and hair and night sweating, normal colored tongue without coating, and the pulse that is fine or floating empty. So, in case of liver indeficiency, you can use the acupuncture points. That is the liver 8, stomach 36, spleen 6, and REN 4 with kidney 6. Again, I am repeating liver 8, HT 36, spleen 6, REN 4, that is CV4, and with the kidney 6. Okay. Then our so whatever points I am discussing, that are the major points. Okay. So no need to preach the lot of points. Okay. You have to preach the minimum needle. So result will become. Okay. That important points you have to needle, result will become. Then our next pattern for the dry skin, our next pattern for the dry skin is the lung dryness. Lung dryness. Okay, so dry skin with the acute beginning is due to lung dryness. When there is the lung dryness is there, so dryness will come with the acute beginning. Okay, so there will be dry cough. Symptoms are dry cough, dry throat, hoarse voice, and dry tongue. And acupuncture point for the lung dryness, for the dry skin, are the lung 9, SP6, range 12, and kidney 6. Lung 9, SP6, range 12, and kidney 6. Again, I am repeating. Write down lung 9, SP6, range 12, and kidney 6. And now let us discuss the full conditions for the dry skin. So in full condition, first pattern is the severe chronic blood stasis. Severe chronic blood stasis. Okay, dry skin due to severe chronic blood stasis is a full condition, and there will be dark face. Symptoms are the dark face, dark rings under the eyes. Okay, pigmentation. Pigmentation will be dark and dark ring under the eyes. Abdominal pain. Patient will be suffer with the abdominal pain and abdominal masses also. And painful period. Patient will be that lady patient will be suffer with the painful period. Okay, that cramps in the thighs, cramps in the lower abdomen, and purple lips. Lip will be purple. When that is the blood stasis. When you see the purple color on the lips and purple color on the tongue, you identify there is the blood stasis. Okay. Purple tongue with the pus that is the wiry and choppy, and other symptoms will depend on the organ involved. Blood stasis caused by dry skin only in the severe and chronic cases. And in this case, the acupuncture point to be used are bladder 17. Okay, bladder 17. It is the inflation point for the blood. Bladder 17, SP10. It is the C point, C of blood, SP10, and the lung 9. This is the major 3 points you can use that you can clear the blood stasis. Now full heat. This is also pattern for the dry skin. Full heat. For dry skin, due to full heat, so there will be red face. Symptoms are there will be red face, feeling of heat, thirst, mental restlessness, insomnia with a tongue that is red with the dry yellow coating. Okay, dry yellow coating. The tongue will be red with a dry yellow coating, and the pulse that is the overflowing and the rapid. Other symptoms and sign, and the acupuncture point will be depend on the organ involved. So in the heat, there will be multiple organ involved. So you should select the acupuncture points as per the organ involved. Now empty heat. Our next pattern for the dry skin, empty heat. For the dry skin, due to empty heat, so there will be scaly skin, scaly skin. Okay, scaly skin, malar flush, feeling of heat in the evening, thirst with the desire to drink in the small sip, mental restlessness, and five palm head. Okay, two palm and two soul and chest. It is a five palm head. Night sweating, scanty dark urine, dark stool, and a tongue that is red without coating, and the pulse will be floating, empty, and rapid. Okay. Other symptoms and signs and acupuncture points will again depend on the organ involved. Our next pattern for the dry skin, wind dryness invading the lung. Okay. Okay. External wind dryness, that is the invading the lung, because lung is the first part can be affected by the external pathogenic factors. Okay, dry skin with the acute onset, so acute beginning is due to vein dryness that attacking the lung. Okay, there will be aversion to cold. What are the symptoms? Aversion to cold. So that cold weather, patient cannot be bear. That there will be aversion to cold, fever, dry cough and dry throat, itchy throat. Throat will be itchy and hoarse voice. Voice will be hoarse, sore throats, and floating pulse. Our next patterns for the dry skin is the wind in the skin. Okay, this pattern you may be not heard. This is a wind in the skin. So dry skin due to wind in the skin will have the itchiness, numbness, or tingling of the limb. So too much itchiness, too much itchiness. Okay, बहुत खाज खुजली हो जाएगी. Okay, it means there is the wind in the skin. Okay, itchiness, numbness, or tingling of the limbs, skin eruption that move around, they comes and go quickly. That skin erection will be there, and they move around, and they comes and go quickly. The up and affect the top part of the body, part of the body. This neither an external wind such as that seen in the common cold and flu, nor an internal wind, but simply wind in the skin. Okay, it's not an internal or external wind. Okay, simply wind in the skin, a condition frequently seen in the skin disease. Okay, this condition frequently seen in the skin disease. Now our next patterns for the dry skin. So liver blood deficiency with the empty wind. Okay, liver blood deficiency with empty wind. So in this pattern, liver blood deficiency with the empty wind will cause the chronic dry skin. And symptoms are there will be itchiness on the skin, scaly skin with the white scales, and slight tremors of the head. Head will be trembling, slightly trembling, and or the hand may be trembling. Facial tics, tics will be there, facial tics, and dizziness, blur vision, unilateral numbness and tingling of the limbs, and tongue will be pale and thin with the choppy or fine and slightly wiry pulse. Okay, so now I am repeating the every pattern's points. Write down for liver blood deficiency. Liver blood deficiency, you can use point. It is the pericardium 6. Please write down pericardium 6, SP6, SP10, liver 8, CV4. ST36, UB13, sorry, UB17, not UB13, UB17, UB18, UB20, and UB23. Okay, all points should be tonification, and all points are bilateral on both sides. Now our next pattern points lung indeficiency. So points are lung 9, SP6, and REN 12. Lung 9, SP6, and REN 12. Okay. Our next pattern, kidney indeficiency. Kidney indeficiency, kidney 3, REN 4, SP6, and REN 12. Again, I am repeating, kidney indeficiency, kidney 3, REN 4, SP6, and REN 12. Liver indeficiency. Next pattern is the liver indeficiency. So, liver 8, stomach 36, SP6, and REN 4, and kidney 6. Again, I am repeating, liver indeficiency, liver 8, SP6, ST36, REN 4, and kidney 6. And next pattern is the lung dryness. Lung dryness. Points are lung 9, LU9, SP6, REN 12, and kidney 6. Again repeating, lung dryness, lung 9, SP6, REN 12, and kidney 6. Now, severe chronic blood stasis. Okay, so points are bladder 17, SP10, and lung 9. Bladder 17, SP10, and lung 9. 3 points are enough for bilateral. And give moxa to bladder 17. Okay, so thank you very much. Thank you for joining my sessions. Enough for today. If you have any queries, you may ask. So message me. So cirrhosis, that is the different part. Okay, dryness. We are discussing for the dryness. Lumps are it is related to liver. Okay, thank you very much. Okay, closing the session.